And we are about to go live on Instagram in 5, 4, 3, 2, 1. Hello everyone, my name is Shanae Jones and this is KNKY, which stands for Know the New Kinky You. I'm your resident sex coach, and first of all, I want to apologize for those of you who are watching live. There appears to be a bit of glitchiness in the feed, and hopefully that doesn't deter you too much. But please know that I record the live post because, again, on Instagram, the stories only last 24 hours. So the goal is to get you to have an opportunity to see it again. So all of the live posts get reposted on YouTube. So you'll be able to see that in the next day or so. So about a week or so ago, I posted on Instagram a request for you guys to tell me things that you are interested in talking about. Last week we talked about squirting, so if you haven't seen that video is available on YouTube already. And tonight we are talking about hypoactive sexual desire disorder. Now, if you don't know what that means, HSDD is also known as inhibited sexual desire. And what it is because we have the word disorder in it, it is a sexual dysfunction and it's disorder that is psychological in nature. It is characterized by a lack or an absence of sexual fantasies and desire and for sexual activity, and is judged by a clinician. And so a clinician in this case, meaning a psychologist, psychiatrist, somebody certified to deal with mental health issues. Now, as a sex coach, I am not qualified to treat someone who has HDSS. Low sexual desire is the common equivalent for this disorder. And there are a lot of people who at times have peaks and valleys when it comes to their sexuality. You know, not being in the mood does not count as HSDD. It doesn't. Not being in the mood for a long period of time, meaning more than 6 months, and this is perhaps something that you are used to feeling a sexual desire. If there's a significant change in that, then perhaps there is a deeper, more psychological issue at hand. So first of all, again, having low sexual desire is common. It happens to most of us at some point in time. HSDD will not start, people that suffer from this, they will not start or respond to their partner's sexual advances. They ignore it, right? And HSDD was actually split, because this is in the DSM, which is a psychological manual. It was split and characterized differently between men and women. And the person that asked me to talk tonight about this particular subject specifically requested information about women, but of course we're going to talk about men and women. So with male, the definition is characterized by persistently or recurrently deficient or absent sexual erotic thoughts or fantasies and desires for sexual activity as judged by a clinician, with consideration for the patient's age and cultural context. So with women, HSDD is defined as a lack of or significantly reduced sexual interest or arousal, manifesting in at least 3 of the following symptoms. So just so you are clear that I want to get this right, so I'm going to read it a little bit. Let's see, where are we? Okay, so no or little interest in sexual activity, no or few sexual thoughts. Computer seems to be frozen. Okay. There we go. No or few attempts to initiate sexual activity or respond to a partner's initiation. No or little sexual pleasure, excitement in 75 to 100% of sexual experiences. No or little sexual interest in internal or external erotic stimuli. And no or few genital or non-genital sensations in 75 to 100% of sexual experiences. So, HSDD has 4 different categories that it can fall in. So general is a general lack of sexual desire. Situational, of course, is you still have sexual desire, but you lack the desire for your current partner. So it's not like it's an everyday thing. It's kind of specific and targeted to the person that you're currently in a relationship with or having sex with. Acquired, meaning that it started after a certain point where things were normal at the beginning, but something changed and now you're just not feeling sex. You don't desire sex. And then there is a lifelong, meaning that you have never had any high interest in being sexual. It's always been low or no sexual desire. So there is an argument, though, that HSDD puts those who identify as asexual, and an asexual person is somebody that can go without sex. It's just not of value or of importance to them. And when that happens, you know, they say that because it's a clinical term, because it's psychological, that the argument has been made that those who identify as asexual have been put in the same position as those who had identified as homosexual between 1974 and 1987, because at that time homosexuality was looked at as a mental disease or defect. So it did not qualify as just, this is who I am, this is me, and I'm okay with that. So at that point, the DSM considered it something that was wrong with you, being homosexual. So now the DSM is considering those that potentially consider themselves as asexual as suffering from HSDD. So just as a note, the DSM removed homosexuality from its manual in 1987. So we had a roughly 15-year period where it was considered, and now not so much, right? So the primary difference between low sexual desire, which again is something that is very common, something that a lot of us can suffer from at some point in times in our lives or another, is that HSDD causes distress and interpersonal difficulty. It's like you become stressed out and it becomes an impeding factor in your life. So you have to be affected by it more than just, I'm not in the mood. So if it persists for more than 6 months again, and it cannot be accounted for by another mental disorder that can be found in the DSM or other or medical condition. So lifelong, people that consider themselves that they have lifelong HSDD, there is no known cause for it, and unfortunately there's no cure for it. So if you are a person that happens to just not want sex, I'm not going to say not enjoy sex, but if it's not at the top of your list or even in the middle of your priority list, then it's perhaps something that you might want to look at a little bit deeper. So there are some other forms of HSDD. So low desire in men. Well, let me take it back for a second. Although there are different categories for HSDD, the cause of HSDD is pretty much the same as it would be in people that have low desire. So in men, it can be caused by psychological and physical issues like low testosterone, low self-esteem, mental issues, emotional issues, performance issues. And I have a whole nother video on performance versus pleasure-based sex when it comes to guys. There's a whole different stress on that. So if you haven't looked at that, please go take a look. Everything is on YouTube. Body image issues, intimacy issues. And let me go back to body image issues. You know, sometimes when people don't feel that they look their best, they don't want to be intimate. They don't want to have someone be that close to them. So it can create low desire in sex because you just don't feel comfortable in your own skin. You know, intimacy issues, when you have issues in your relationship, if there are problems, and there's a recent post on Instagram now about when you're fighting in your relationship and how when you're fighting, you know, you don't necessarily think that you're in the mood to have sex with you because you don't want to have sex with that person. So it creates a low desire. Exhaustion, stress, and anxiety. If you have worries in your life, day jobs, kids, families, bills, obligations, all kinds of stuff, that can affect your sex life. It is going to put you in a position where you're not going to want to have sex. Sexual ignorance is another key thing, which is part of the reason why we come together to have these conversations, because sometimes people just don't know, and they aren't comfortable enough to talk to their partners or with somebody that is going to not give them pornesque advice on sex. So sexual ignorance can lead to, I don't know what I'm doing, so I'm not going to put myself out there to have sex. Low desire in women comes from aging. You know, I know that as a 40-year-old woman, how my sex drive as a 20-year-old woman is different than it is today. You know, I personally prefer quality over quantity. So when you're talking about a high sex drive, and even when you're talking about low sexual desires, you have to consider what it means to have, and my screen froze over here, but I'm assuming that it's still going. Sorry. When you have a imbalance in your sex drive with your partner, it can cause additional issues, but it will keep going. Let's see, hormones, relationship conflicts, and power struggles. Again, with women, body image issues is another thing that you have to consider as potentially an issue. Fatigue, you're tired, you don't necessarily want to have sex. History of sexual abuse or an unskilled lover, that can also cause issues for women in sexuality or in desire, low sexual desire. So physical disability, pain, vaginal pain, it can cause problems too. Give me 1 second because this screen seems to be frozen, and I hope that it's still going live, but we'll see. Let's see. Okay, well, it still says it's recording, so we're going to keep going. So how do you treat HSDD? You treat it, well, it's a psychological disorder, again, remember. So talking to a therapist is going to be your best course of action. They do have medicines that have been approved by the FDA that can be prescribed to you. One medication, and I'm going to mess up the name, so please excuse me. Filibacerin was approved by the FDA for HSDD in premenopausal women. Then you have, this one I'm really going to mess up, so excuse me again. Bremelanotide. I'm going to spell it. Bremelanotide. Bremelanotide, which approved in June of 2019. So HSDD is predicated on relationship issues, and the thought process behind it is that if you can get through fixing whatever is going on in your relationship, that you will be in a better position to deal with those things that are causing your low sexual desire, that HSDD, right? Perhaps. If it is a non-psychological issue, you can always talk to someone like me, who is a certified sex coach, who will also help you deal with your relationship issues and your sexual concerns. But it does not, and I repeat, it does not come from a psychological therapist perspective. It comes from understanding, trying to work with you to understand your sexual goals, trying to work with you and your partner perhaps on trying to come up with a medium, a middle ground of consideration and of a way to kind of balance out how to evoke from you what works best for you. So that is my spiel for this evening. I am Shanae Jones, your resident sex coach. Again, I do coaching, so if anyone has any issues, questions, concerns, things that they want to talk through, you can always DM me. We can set up a free 30-minute consultation. I always do quick mini sessions via DM. As much as I can help you with an issue, I will. But if it looks like it's something that we want to talk a little bit more deeply about, then we can set up a free 30-minute coaching session. And if you want to choose to work with me as a coach, we can go through the details on that. Everything I do across all social media platforms is at DOYOU KNKY. Do you KNKY, which stands for Do You Know the New Kinky You. Please visit my website. It's at the same name. And I will see you again here next Wednesday to talk about whatever it is that you want to talk about. So again, go back to the post that says, what do you want to talk about? And I will be able to address those concerns for you. Thank you again, and I appreciate your time. Good night.